And welcome back to The Factor Uncensored. We all need to keep in mind, young people can also struggle with mental health issues. My next guest has advice for parents who may need extra help dealing with them and dealing with themselves. Joining us tonight here on The Factor Uncensored, we have with us Dr. Melanie Ribick. And Dr. Ribick, for those parents who are finding themselves in a tough situation dealing with mental health concerns of their children, how should they first approach it when they notice there is a problem?
Yeah, I think parents should approach their children with an open mind and without judgment, without making their child feel bad for maybe having some struggles with their mental health, and let their child know that it's okay to have issues, but that we need to know what those are in order to address them and to get them help if they need it.
And what are some of the signs that your child may be going through some issues and you haven't had them diagnosed? You're seeing this for the first time.
Mm-hmm. Sure. Sometimes in children, their mood might be irritable instead of depressed, or you might notice a child who's withdrawn or who's having trouble at school when they used to be a good student.
And obviously, the school will have your kids for anywhere from 8 to 9 hours a day. Should you be in constant communication with the school nurse or the counselor to ensure that your child may be getting the help they need there as well? Or should it be something you take care of at home with your private doctor?
I think both of those are reasonable opportunities and places to go to get help. I think the schools know that they're required to reach out and help students that are struggling. So guidance counselors and nurses are great resources if a parent makes that the place where they think their child would get appropriate care. But certainly reaching out to your child's primary care provider is also always an option.
What are some of the more prominent or likely mental health concerns that children, young people are dealing with, say, in 2022?
Yeah, we see children who struggle with everything from depression to anxiety to substance use. It really runs the gambit. But I think a lot of children, those who were isolated during the pandemic, we definitely saw more children struggling with their mood during that time.
And for parents who are providing for these children, getting them the care and treatment that they need, should those parents also make sure they take care of themselves? Because I've seen parents who may have kids with mental health concerns and they look beaten down. It looks like they've gone through the ringer, but they're doing the best they can for their children. How do they make sure they take care of themselves as well?
Absolutely. So there are mental health crisis hotlines for parents who feel like they have nowhere else to turn to, or if they're struggling, if you're worried that your child is at risk, or if your child, you don't think they're safe, you can dial the national hotline number. That's 988. You can also text that. It's super important for parents to recognize what their own mental health status is, and make this part of what they take care of as a family, right? We all need to have good mental health if we're going to be helping our children with their own.
Absolutely right. Dr. Melanie Ribick, thank you for joining us here on The Factor Uncensored and for the great advice tonight for those families out there who may have their hands full.